on Chapter 14 in the Corey textbook. The theory we have picked to focus on is structural strategic family therapy. The history of family therapy dates back to the 1950s when systemic therapy began to develop. Working with families was considered to be a revolutionary approach to treat individuals and best understood through assessing the interactions between and among family members. Behavioral, humanistic, and psychodynamic approaches dominated the counseling and psychotherapy in the 1960s and 70s. Some contributors to family systems therapy include Murray Bowen, who was one of the original developers of mainstream family therapy, Virginia Satir, who developed conjoint family therapy, which emphasizes on communication and emotional experiencing, Carl Whitaker, who is the creator of symbolic experiential family therapy, which helps families open channels of interaction, Jay Haley and Cole Maidens, who founded the Washington School of Strategic Family Therapy, which blended structural family therapy with concepts of hierarchy power and strategic interventions. Salvador Minuchin, who developed structural family therapy that helped families modify the stereotype patterns and the relationships among the members. And lastly, Alfred Adler, the first psychologist in the modern era for family therapy to use the systemic approach.
Alfred Adler played an important role with the development of family therapy. He was the first psychologist in the modern era of family therapy to use the systemic approach. Adler set up more than 30 child guidance clinics in Vienna after World War I. He later brought the concept to the United States in the form of family education centers. This is not to be confused with Adlerian theory, but similar interventions do exist. Adler was just the beginning. Others would contribute more to structural family therapy, such as Salvador Minuchin. Salvador Minuchin was born and raised in San Salvador, Argentina. He began to develop structural family therapy in the 1960s through his work with delinquent boys from poor families at the Whitwick School in New York. While working in Philadelphia in the 1970s, Minuchin redefined the theory and practice of structural family therapy.
As mentioned before, our group chose the theory of structural strategic family therapy as our focus. It can be traced back to Salvador Minuchin in the early 1960s, as stated by Justin. The central idea was that an individual and their symptoms are best understood and can be relieved better through looking at the whole family system. Structural strategic family therapy also believes that changes must occur within the family structure before the individual's symptoms can be relieved. Family systems not only consist of individuals but of subsystems. Together, these make the family what it is. Subsystems include parental subsystem and the spousal subsystem. Together, these two systems may consist of the same people or different people in the cases of divorce and remarriage. Then there is the sibling subsystem. As in all counseling sessions, there is an assessment that is done, and it can be done in several different ways. The first way assessment is done is through a genogram, which allows the family structure and stories to be presented in a clear and orderly manner. Then there's testing and rating scales. As with all therapeutic techniques, family systems therapy begins by forming a relationship with the family. The counselor makes an effort to make contact with each person. Also, each person in the family is treated with openness and concern. This helps reduce any anxiety that the family may already be feeling. The competent family counselor knows that skills and communication, understanding, and empathy through active listening are the foundation for a good working relationship.
The therapeutic approaches between systemic therapy and individual therapy are vastly different. For individual therapy, the therapist may focus on obtaining an accurate diagnosis, most likely from the DSM. They will begin therapy immediately and focus on causes and purposes. They will also look for ways to help the client cope with the problem. For systemic therapy, the therapist may use a genogram, as Michelle mentioned, to look at the family system. They may also invite the client's immediate family into therapy. They focus on family relationships as a way of understanding clients' issues. They are concerned with the transgenerational aspects within the system. Aspects include meanings, rules, the culture, and gender perspectives, even the communities and larger systems affecting the family. Interventions include ways designed to help clients change their context.
The goals of structural strategic family therapy are twofold. Goal 1 is to reduce symptoms of dysfunction within the family, as well as Goal 2, to bring about structural change within the system by modifying the family's transactional roles and developing more appropriate boundaries. To facilitate change in the family, the therapist can initiate several things, including enactments and assignments of tasks. These work best when and if the family work together to construct them. Some of the limitations of family therapy include the counselor's approach. Family therapy systems work with little concern for the individual as long as the whole of the family functions better. The family in their theory was often perceived as a well-oiled machine or perhaps a computer that occasionally broke down and could be fixed easily without consideration of the parts involved. This concludes our family systems therapy session. Thank you for joining us.